Washing my hands. Hi, I'm Amber Jeeps, and I'll be taking care of you today.
I'm Brooke Royce.
Hi, Brooke. It's nice to meet you.
Nice to meet you.
Can I get your date of birth?
9/24/97.
Okay. Well, I'm going to be taking care of you today. I'm going to be getting a little bit of history, okay? And then we'll go over what's going on with you, and then I'll take a look at you, and we'll go from there.
Okay.
Okay? Just going to show my book page. All right. So can you tell me what's going on with you today?
I'm really congested. I'm hurting. My ears hurt. My throat hurts. I feel so sick. So,
Okay. Do you have a cough?
yes.
You do have a cough.
Mm-hmm.
All right. Have you ran any fever?
Yes. I was running fever last night.
Okay.
I took some Tylenol.
You took Tylenol. Okay, good. And what did it get up to?
102.
Okay.
102.
All right. And how much Tylenol did you take?
1,000 milligrams.
Good. Have you taken any Tylenol since then?
No.
No. Okay.
Probably should have because I feel like I'm feeling pretty bad.
Yeah. I was going to say, reviewing your vital signs whenever I came in, your temp is up to 101.6 right now.
Mm-hmm.
All right. So, is there anything that makes it worse? Anything that you're around, anything you're exposed to that makes all the symptoms worse?
No, not really.
No. Okay. Is there anything that makes it better?
Yes, I take Alka-Seltzer and Robitussin.
Okay. All right. So, do you take them together?
Yes.
Okay. So, I want you to be careful taking them together because sometimes the Alka-Seltzer and the Robitussin have some of the same ingredients in them,
Okay.
some of the same cough suppressants, some of the same decongestants.
Okay.
So, you want to be careful taking stuff like that together. You don't want to over medicate. Okay. But do those seem to help you? They seem to kind of clear it up?
Yeah.
And then it comes back, or does it kind of ease up a little bit?
It eases up a little bit, but then the next day I'll wake up again.
Okay. So are you taking them around the clock, or are you taking them just kind of when you feel your worst?
Just kind of when I feel worse.
Okay. All right. About how many times a day would you say?
Probably like maybe 1 or 2 times a day.
Okay. All right. And then, as far as the Tylenol goes, you just took it that one time for the fever.
Yeah.
Okay. All right. And when did all these symptoms start?
About a week ago.
Okay. And then what made you wait till now to come in?
I was thinking it would pass, but it didn't pass. And so,
It just kind of started feeling worse.
Mm-hmm.
You decided to finally come see me today.
Yes.
All right. So I'm going to go ahead and get a little bit of family history so that we have it on the chart.
Okay.
A little bit of history about you, and then we'll kind of go over everything else. Okay. As far as family history goes, do you have any pertinent family history? Diabetes, high blood pressure, thyroid problems, cancer?
My brother has high blood pressure.
Okay.
My mom has, my mom's mom has, died of cancer.
Okay. Do you know what kind of cancer?
I think neurological.
Okay. All right. Any history of anxiety or depression or anything of the sort?
Not with me.
Not with you. What about in your family?
My mom has anxiety and depression.
Okay. And then for you, are you married?
No.
No. Do you smoke?
No.
Any other tobacco products, pipes, cigars, vaping, anything like that? Okay, what about illicit drugs?
No.
Do you drink alcohol?
Yes.
Okay, how often?
Just social.
Social drinking. Okay, so maybe a drink every now and again, you go out to eat. Okay, all right. And other than the Robitussin, the Alka-Seltzer, and the Tylenol, do you take any daily medications?
No.
Any vitamins or supplements?
Probably should take vitamins, but I don't take it.
Okay. All right. And do you have any allergies to medication?
Mm-mm.
Do you have any allergies to food?
No.
Any latex or iodine allergies?
Mm-mm.
No. Okay. Okay. What about seasonal allergies?
In the past 2 years, I've been getting them around this time.
Okay, so maybe a little bit of seasonal allergy.
Mm-hmm.
Do you take any medications like Claritin, Zyrtec, anything like that?
No.
Okay. All right. And then what about like yearly visits with a primary care provider? Do you do any like yearly physical exams?
No.
Okay. Do you know when your last one was?
No.
Okay. All right. So it's very important to follow up on those yearly physical exams. Okay. Most people wait till they get sick to go to the doctor.
Yeah.
Okay. But those physical exams are built for the preventative care. Okay. That prevents those big things from happening.
Yeah.
Get your blood work checked, get in front of the problem before it starts. Okay. What about vision and hearing? Do you get those checked?
No.
And then what about dental work?
Every 3 months.
Every 3 months. So you take care of your teeth.
I take care of my teeth.
You gotta take care of the rest
That's
of
what you can see in your
you.
teeth. So gotta take care of it.
All right. And then how about vaccines? Are you up to date on your vaccines? You
I
are.
am.
Okay. Have you had a flu shot?
No, I was gonna get it this weekend, but since I've been really sick, I haven't gone. I have to get it for school.
Okay, so you're in school.
Yes.
All right. What are you in school for?
Radiology tech.
Oh, very good. All right. Do you work outside the home?
Yes.
What do you do?
I'm a waitress.
Awesome. Okay. Have you been around anybody that's sick? Especially in
I'm
that
sure.
school
I'm
in
in
the
the
hospital.
so I'm sure I've been around people with the flu and stuff like that. So I'm sure something's going on.
Okay. All right. Yeah, there's a lot of sickness in the hospital right now this time of the year. Okay. And then you said all your other vaccines are up to date.
Yeah.
Very good. When was your last menstrual period?
2 days ago.
Okay. All right. Have you ever had any pregnancies?
No.
Are you on birth control?
Yes.
Which one?
The Kalina IUD.
Okay. And when did you get that placed?
2 months ago.
2 months ago. Okay. Do you go to the gynecologist every
Yes.
year like you're supposed to?
Yes.
Very good. Have you ever had an abnormal pap smear?
Yes.
Okay. All right. So that's very important that you go.
Mm-hmm.
When was your last checkup? Was it when you got the IUD put in?
Mm-hmm.
So about 2 months ago.
Mm-hmm.
Okay. All right. Have you ever had any major illnesses or traumas?
No.
What about surgeries?
No. I've had surgery and I had mouth surgery.
Okay.
2011.
Oh, okay. What about hospitalization?
No.
Okay. All right. So let's talk about right now.
Okay.
How are your eating habits? How are you doing as far as eating goes with everything
Well,
going
right
on?
now my throat is like kind of sore from like the drainage, and so my throat is a little sore, so I'm not really able to eat as much as usual.
Okay. Any weight loss?
No.
Okay. Have you noticed any changes in your throat? Any swelling? Any pus pockets? Anything like that besides
I feel
the
like
drainage?
I do have pus pockets.
Okay. What about your eyes? Have you had any problems with your eyes, swelling or discharge?
They're like really crusty in the mornings when I wake up.
In the mornings. Okay. What about throughout the day? Have you noticed any coming out of your eyes throughout the day? What about your ears? How are your ears feeling?
My right ear hurts pretty bad. They're both really itchy, but my right ear is the worst.
Okay. Have you noticed any discharge coming out of your ears?
Mm-mm.
No. What would you rate your pain?
A 5.
A 5?
Mm-hmm.
0 to 10? 5?
Yeah.
Okay. And then what about as far as your nose goes?
Mm-hmm.
Are you like super stopped up? Is it really runny?
Mm-hmm. It's really stopped up, and then it gets worse at night.
Okay.
Whenever I lay down.
Okay. All right. And then what about, do you ever have any drainage?
Mm-hmm. It's like yellow, my
Okay.
drainage.
Okay. As far as your cough goes, whenever you cough, is it like a really dry cough or is it a wet cough?
It's wet.
It's wet. Okay. And whenever you're coughing that stuff up, what color is it?
Yellow.
Okay. Let's see. As far as your face goes, is there any pain on your face?
Yes, it's really right here.
Right
There's
here.
a lot of pressure right here.
A lot of pressure. Okay, what would you rate that? 0 to 10?
5.
All right. Do you have a headache?
Yeah.
All right. As far as your breathing goes, are you having any wheezing that you've noticed?
No.
No wheezing. What about trouble breathing?
No.
Any shortness of breath?
Mm-mm.
Any chest pain?
Yes, whenever I cough.
Whenever you cough. Okay. All right. Anything else going on?
Not that I know of.
Okay. All right. So I'm going to take a look at you.
Okay.
Putting on my gloves. All right. I'm just going to take a look at your ears.
Okay.
Okay. And you said your right one's hurting?
Yes.
All right. So I'm going to take a look at your left one first.
Okay.
Oh, yeah. Your left one looks good.
Mm-hmm.
All right. Look at your right one. I'm going to be really easy.
Ow!
Oh, sorry.
Ow, 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 ow.
Oh, yeah.
Ow.
I'm sorry. That one's really red. Okay. All right. Just going to take a look at your eyes.
Okay.
See if I can see any discharge. Okay. Those look okay. Look at your nose. All right. Open for me. Say, ah. Oh, yeah. Your throat's really red and lots of pus pockets back there.
I figured.
All right. I'm going to fill this lymph nodes, okay?
Okay.
I'm just going to fill your neck. A little bit of swelling.
Mm-hmm.
Okay. I'm going to take a listen.
Okay.
I just want you to breathe in through your nose and out through your mouth, okay? Sorry, my stethoscope is cold.
Okay.
All right, deep breath in. Good. And go to the other side. And again. And again. All right, and just breathe normal for me. I'm just going to listen to your heart. Heart sounds good. Just a little bit of elevated heart rate, probably due to the fever that you're running. Your skin is really clammy too.
Yes.
All right, just going to listen back here, okay?
Okay.
Deep breath in and out. And again. Just going to listen down below, okay?
Okay.
And again. And last time. All right. So your lungs sound good.
Okay.
Okay, that right ear is very red. Okay, it's looking kind of nasty in there. Your throat's really red. I see all that drainage back there that you're talking about, and definitely those pus pockets too. Okay, so what we're going to do is we're going to test for flu. Okay, so I'm going to swab for flu and I'm going to swab for strep. All right. The flu test is going to be just a little swab in the nose. Okay, very quick and easy. And then the strep is going to be just a swab in the back of the throat. Okay, pretty easy too.
Look.
Okay, so as soon as we get those results back, we'll know. I'm gonna go ahead and test for both since you've been around people that have had the symptoms for both, and we just kind of don't know what you've been exposed to in the hospital. Okay, but also if the strep comes back positive, we'll do some antibiotics. Okay, that'll knock out that infection, and it'll help your ear as well. If the flu comes back positive, okay, if the flu comes back positive, then we'll do an antiviral, okay? Since it is a virus, it has to run its course, okay? But the antiviral kind of helps with all these nasty symptoms you have going on, okay? On top of that, you can do warm salt water, gargle that in your throat. That'll kind of help with that throat pain, okay? The Tylenol, keep the fever down. Tylenol, ibuprofen, whatever helps. You can alternate them, okay? And then you can continue taking either Alka-Seltzer or Robitussin. Not both of them together, okay? One or the other, and that'll kind of help all this congestion too that you have going on, okay? Is there anything else that you want to add? Any other questions that you have?
I don't think so.
Okay. So we'll wait for those results. We'll get that. We'll get you your medication. If you're not better within a week, I want you to follow back up with me.
Okay.
Okay? All right. Thank
you
you so
so
much.
much.